It is 11 p.m. You are getting ready for bed. Your cat is sitting in the corner of the litter box, straining, and nothing is coming out. You watch for a minute, telling yourself it is probably nothing. Then you hear it a small, painful cry. I know exactly how frightening that moment is. Your mind starts racing. Is this an emergency? Should you wait until morning? Should you call the emergency vet and risk an $800 bill for something that turns out to be nothing? And what's worse, cats are experts at hiding pain. By the time you notice something is wrong, they may have already been suffering for hours, sometimes days. But what if I told you that your cat is already telling you exactly what is wrong, right now, in ways almost every owner misses? What if I told you there are 5 specific signs that separate "let's watch and see" from "get in the car this second"? Today, I'm going to show you exactly what those 5 signs look like, why they happen, and what you need to do the moment you see them. Hi everyone, I'm Dr. Marcus, your neighborhood veterinarian, and welcome back to the channel. If you're new here, I dedicate this entire channel to helping you become the most confident, prepared pet parent you can possibly be, using real veterinary knowledge explained in plain, simple language. Before we dive in, drop the guilt. If you have ever hesitated before, told yourself it was probably fine, or felt embarrassed calling an emergency line at 2 a.m., you are not a bad pet parent. Cats are simply built to mask illness. It is a survival instinct left over from the wild, where looking weak made them a target. The fact that you are watching this video right now trying to learn the difference proves how much you care. I actually made a video on how to build a cat first aid kit at home, which I will link at the end of this one. So today we are doing a complete masterclass. Grab a notebook because I am about to walk you through 5 warning signs that mean your cat needs emergency care tonight, not tomorrow. These are not maybe signs. These are the signs vets see walk through the ER doors every single week, often too late. Let's get into it. Sign number 1 is straining in the litter box, especially in male cats. This is the one I want you to burn into your memory, because it is the most time-sensitive emergency on this entire list. Here's the problem. Your cat goes into the litter box, crouches, strains, and either nothing comes out or only a few drops, sometimes tinged with blood. You might assume this is constipation, but here's what's truly fascinating and also terrifying. In male cats, this is very often a urinary blockage. Their urethra is narrow, and it can become completely obstructed by crystals, mucus, or inflammation.
Ow.
Once it is blocked, urine cannot leave the body. The toxins build up in the bloodstream within hours. Left untreated, this becomes fatal, usually within 24 to 48 hours from kidney failure or a ruptured bladder. This is not something you wait out overnight. If you see your cat straining and producing little to no urine, that is an emergency room visit tonight. Full stop. Do not offer water and wait. Do not try a home remedy. Get in the car. Now, here's a quick warning. Even female cats can experience partial blockages or severe urinary tract infections that mimic this. So this rule applies to any cat, not just males. Sign number 2 is open mouth breathing, or breathing with the belly instead of the chest. Let me guess. You're probably thinking cats pant like dogs sometimes when they're hot or stressed. Here's what's actually happening. Healthy cats almost never breathe with their mouths open. It's not like a dog cooling off. When a cat breathes with its mouth open, or you notice its belly heaving in and out with every breath, instead of the chest moving normally, that is the body working overtime to get oxygen. This can come from fluid around the lungs, a collapsed lung, heart disease, or asthma so severe the airway is closing. Stick with me here because this one is important. A cat in respiratory distress can go from struggling to unconscious in a very short window. There is no home treatment for this. The only correct response is immediate transport to an emergency vet. And I mean keep the car ride as calm and quiet as possible, because stress alone can worsen the breathing further. Here's the warning. Never restrain a cat that is struggling to breathe tightly against your chest, as that added stress and pressure can push them over the edge. Carry them gently in a covered carrier instead. Sign number 3 is sudden collapse, extreme weakness, or pale or white gums. I promise you, this sign gets overlooked more than almost any other, because owners assume the cat is just tired. But what if I told you gum color is one of the fastest ways to check for a life-threatening emergency at home in 10 seconds? Healthy cat gums are a light pink, like the inside of your own lip. Gently lift the upper lip and take a look. If the gums are pale pink, white, gray, or even blue or yellow, that points to serious internal problems, severe blood loss, shock, heart failure, or anemia. Combine that with sudden collapse or a cat that cannot stand normally, and you are looking at a true crisis. The body is not getting enough oxygen carrying blood to its tissues. This can happen from internal bleeding you cannot see, toxin exposure, or a heart condition finally reaching a breaking point. If your cat collapses or you find pale gums, this is an AI visit immediately, and if possible, call ahead so the team can be ready the moment you arrive. Here's the warning. Never give a collapsed cat food or water, since they may not be able to swallow safely, and it can cause choking. Chapter number 4 is my personal favorite to teach, because it saves lives simply by knowing what to look for. Repeated vomiting combined with a hard, swollen, or painful belly. 1 or 2 vomits after eating too fast is common and usually harmless. But what if the vomiting will not stop? Your cat cannot even keep water down, and when you gently touch their belly, it feels tight, bloated, or your cat cries out or pulls away. Now here's what's truly fascinating about this one. A hard, distended abdomen combined with repeated vomiting can point to a bowel obstruction, often from a swallowed string, hairball, or foreign object, or it can point to a twisted stomach, which is a true surgical emergency. Both cut off blood supply to internal organs within hours. This is not a give it 24 hours and see situation. Repeated vomiting that will not stop, paired with belly pain or bloating, needs Samnite evaluation. Here's the warning. Never try to induce vomiting or give any human medication like Pepto-Bismol or Tylenol to a vomiting cat. Tylenol in particular is fatally toxic to cats, even in tiny amounts. Sign number 5 is any sign of toxin exposure or trauma, drooling, tremors, seizures, staggering, or a known fall, car accident, or exposure to a toxic plant or chemical. Let's talk about what's happening here. Cats are extremely sensitive to substances that seem harmless to us. Lilies, for example, can cause complete kidney failure in a cat from just a small amount of pollen. Common household items like onions, xylitol, found in sugar-free gum, certain essential oils, and even some flea medications made for dogs can be toxic to cats. If you see drooling that will not stop, muscle tremors, stumbling, disorientation, or an actual seizure, or if you know your cat was hit by a car, fell from a height, or got into something they should not have, this is always an emergency. Time is critical because many toxins can be treated effectively if caught early, before they cause permanent organ damage. Here's the warning. If you know what your cat ingested, bring the packaging or a photo of the plant with you to the vet. It genuinely speeds up treatment and can save your cat's life. Now, please listen closely because this is a massive veterinary warning. The single biggest danger with all 5 of these signs is waiting. Cats hide pain so well that by the time a symptom becomes obvious to you, their body has often already been compensating for hours or even days. Let's just watch him overnight is the sentence I hear the most from owners in the ER. And it is the sentence I wish I could take back time on more than any other. If you see any of these 5 signs, the safe move is always to call your emergency vet clinic. Describe exactly what you are seeing and let them tell you whether to come in. It costs nothing to make that call. It costs everything to wait too long. Here's the golden rule for staying ahead of all of this. You do not need to memorize a medical textbook. Daily, spend just 30 seconds watching your cat use the litter box and eat, so you notice immediately if something changes. 2 to 3 times a week. Gently check their gum color and run your hands along their belly during a calm cuddle session, so you know what normal feels like for your cat specifically. As needed, the moment you notice any of the 5 signs we covered today, call your emergency vet clinic first and follow their guidance on whether to come in right away. The whole daily check should take you no more than 1 minute, and it could be the minute that saves your cat's life. Worrying about your cat's health is one of the hardest parts of being a pet parent. But by choosing to learn these 5 signs, by choosing to spend just a minute a day paying closer attention, you are proving how much you truly love your cat. And that makes you an incredible pet parent. If this video gave you more confidence today, please hit that like button. It helps more worried pet parents find this information when they need it most. Subscribe and hit the bell so you never miss our weekly deep dives. And please leave a comment telling me, has your cat ever shown one of these 5 signs? And what did you do? I read every single one. Give your sweet, beautiful cat a gentle scratch behind the ears for Dr. Marcus tonight. I'll see you in the next one.